Now in this video, I'm going to show you how to use live drug-to-drug interactions with the virtual assistant when you have a patient and you are considering starting a particular medication, or you just want to know if there's going to be potential drug-to-drug interactions or contraindications. So for this particular patient, let's assume that I'm going to start them on endone, or I'm thinking of starting them on endone. So I would just ask Sam, I'm thinking of starting this patient on 5 milligrams endone. Are there any particular drug interactions or contraindications I should be aware of? So not only will Sam give you the information about any potential drug interactions for endone on a general scale, Sam will actually look specifically at the patient's data, their medications, their medical history, any comorbidities, and bring to your awareness any potential contraindications there might be. And this is great for those patients that do have complex comorbidities, and there's lots of different things to consider, particularly things like when there might be mild renal impairment, or there might be cardiovascular diseases, or any other type of physiological impairment. Sam will be able to give you that information. So you can see here it's given me the answer for endone. Be aware of several drug interactions. So because this patient has heart disease, Sam has talked about respiratory depression with CNS depressants. So if we are going to start on anything else, could increase the risk of respiratory depression. Talks about how endone is actually metabolized through the CYP enzymes. And given the history of substance abuse, Sam is also giving us those recommendations as well. So you can see how Sam has considered the entire picture, not just the general drug interactions, but this patient's specific medical history, including their substance use history, their current health conditions, and other medications that they're taking. So Sam takes all the fear out of looking at all the different drug interactions, and he includes a comprehensive approach to assessing and starting medications with patients.